As part of her philanthropic work, the First Lady of Zimbabwe, Amai Mnangagwa, who is also the National Ambassador for Health, made a special visit to the Mugabe Central Hospital for the official handover of health equipment secured and donated by NetOne and TelOne in collaboration with Angel of Hope Foundation and its international partner, MATA. To kickstart the occasion, the First Lady officially opened a refurbished Orthopedic and Maxillofacial Ward, whose facelift was also made possible by the Angel of Hope Foundation and its mentioned partners. Honorable Minister of ICT, Postal and Courier Services, Comrade Jenfan Muswere, and Ministry of Health and Childcare Deputy Minister John Chamunorwa Mangwiro, Ms. Chipo Jaison and Chipo Mutasa, CEOs of NetOne and TelOne, respectively, and the management of Mugabe Central Hospital were among the guests who graced the occasion. The First Lady highlighted that healthcare is a critical issue in the nation, which is why she is working hard to implement various initiatives that seek to improve public health facilities across Zimbabwe.
I'm delighted to be officiating at this event today, which is highlight of the hard work that has been put to support one of the major central hospitals in our country, Mugabe Central Hospital, during these trying times. The hard work I've witnessed here today is most pleasing, especially as it depicts how collaborative effort can easily help us to rebuild and capacitate health facilities countrywide. On that note, let me commend the two state-owned institutions, TelOne and NetOne, for coming up with this exemplary initiative. This is certainly the way to go if indeed we want to achieve more and get our health system back on track. Specifically, the intervention we have witnessed here today is timely and most critical at this point for the Mugabe Central Hospital, which is the biggest referral hospital in the country with a bed capacity of 1,186. As we all know, many of our vulnerable people are cared for at this hospital. It therefore becomes imperative that we focus on ensuring that the facility is capacitated, especially as a way to create a safety net for our people. I also take note, and indeed I am pleased with the wider scope of the project at hand. We have seen the ward refurbishment, the boreholes and the equipment right before us. I have also been made aware of a prior donation of personal protective equipment, the PPEs, done in May for the health workers, and these donations were valued at Zimbabwe dollars 10 million. This is what happens when individuals and organizations come together with a noble intention. The results show that, indeed, we are stronger together. My message today is to therefore implore other corporates and donors to consider structuring their corporate social responsibility deliberately, targeted to improve our public hospitals, as access to health is a core indicator of development in any given country. The call is even urgent now, more than ever, in view of the COVID-19 global pandemic. While faced with this, we also have other diseases like cancer, malaria, HIV/AIDS, which remain alive and demanding management by the same hospitals. Maternal and pediatric health are also areas that remain key on our health radar. It is therefore delighting to note the ward refurbishment and borehole drilling initiatives will live beyond the challenges of the moment. As we celebrate the TelOne and NetOne collaboration, I am pleased to wear my jacket as Angel of Hope Foundation patron and share on how through the programs at the foundation we have also collaborated to contribute to the revamping of our country's health facilities in our small way. As we gather here today, besides the amazing work done by TelOne and NetOne, we are also witnessing the handing over of hospital equipment worth $348,000, which was sourced from Angel of Hope Partners, a United States-based NGO, Meta. Again, I most sincerely appreciate the shipping and logistics support of $20,400 provided by TelOne, which made it possible for the equipment to be delivered to Zimbabwe. Angel of Hope Foundation has a 3-year memorandum of understanding with Meta that covers provision of equipment to public health facilities in Zimbabwe, urban and rural, sustainable nutrition and agriculture, and access to ICT-based education through innovation hubs. To this end, I am pleased to highlight that we have worked on the following: Lukosi Hospital and Wange Hospital refurbishment, provision of a theatre hub equipment and nutrition plots with agriculture equipment provided, all valued at $900,000. Victoria Falls Hospital refurbishment with state-of-the-art equipment and nutrition garden valued at $750,000. Victoria Falls Primary School establishment of technology hub fully kitted by Apple valued at $250,000. Takashinga Primary School, Yetcliff, establishment of innovation hub valued at $250,000. In our work with Meta, I also acknowledge the Love for Africa Foundation in Zimbabwe, who were instrumental to bringing us together. Love for Africa Foundation has been partners in providing logistics for shipments from the USA and the construction of buildings required to house equipment at schools and ancillary facilities. It is evident that the work by Meta cannot be done by themselves alone, but it requires partners who can collaborate and assist in bringing the much needed assistance for the country. To this end, I would like to thank TelOne for realizing this need and coming up with the support needed to bring the equipment. It is regrettable that because of the current circumstances, where there are travel restrictions globally, Meta representatives are not able to travel to Zimbabwe to witness the handover that we are doing today. I am, however, pleased to have received a personal message of solidarity from Mr. Quentin Mati, the president of Meta, and who is also my good friend. He has requested me to express how delighted they are to hear that the container of the medical goods arrived safely and can begin to be put to good use to serve the wonderful people of Zimbabwe. He further says that Meta is committed to continuing our partnership well into the future and intends to travel to come on site in Zimbabwe as soon as possible. It is therefore humbling to note that we have in Meta a partner for the long term who can assist us in bringing the change we need in our country. I do hope that corporates can come on board, as has been done by TelOne, to partner Meta in bringing more containers with much needed medical goods. Angel of Hope Foundation will be there to provide the support and guidance where required equipment and areas that need urgent address. Allow me to conclude with words of counsel to Mugabe Central Hospital management and staff. While business and others will continue to come out to support the hospital, you have the duty as custodians of all the equipment and infrastructure to ensure that they are taken good care of. Let us guard these things with utmost sincerity because they make our work easier. Once again, let me express my delight at the thoughtful gesture by TelOne and NetOne. We look forward to your